Go ahead.
Good afternoon, everyone. This is Dr. Poornima Mathur from Oasis Fertility. Today, we are going to talk about a very less discussed topic: premature ovarian insufficiency. I'm sure majority of the people around would be unaware about it. So, hence, I decided that let me create some awareness about this thing. So, we all know what is a regular menstrual cycle because we've all been through this, talked about how my cycles are regular or irregular. So, a little more elaboration. When we talk about regular menstrual cycle, it does not necessarily mean it does not necessarily mean excuse me, just a sec, I'll just share my PPT. So when we talk about so coming back to regular menstrual cycle, we are generally of the idea that 28 to 30 days is regular menstrual cycle. But it can be somewhere between 21 to 35 days, varying for an individual girl or lady. So, somebody might be having her regular menstrual cycle every 24 days, the other might be having it every 30 days. That's a regular menstrual cycle. But at times, the cycles can be irregular. We get it every 15 days, get it every 40 days. So, this incidence of irregular cycle that usually varies between 5 to 35%. The incidence keeps on increasing with the advancing age. So generally, what happens is we have most of the people think that way that if I have an irregular cycle, क्या मुझे PCOS तो नहीं हो गया है? मैंने इधर सोशल मीडिया पे देखा था, मैंने अपनी फ्रेंड से सुना था, उसको PCOS था, डॉक्टर ने मेडिसिन दी और एक्सरसाइज बोली, and उससे उसकी cycles regular हो गई. I've had so many patients who've come to me and said this is what they've been doing for the irregular cycles. So let me tell you one thing. The irregular periods or irregular cycles, they can have a different cause for every lady. So I might have my irregular cycles due to PCOS. You might have it due to because of a thyroid disorder. Somebody might have due to an ovarian cyst. So the most common causes if you're talking about irregular periods, so one is your thyroid disorder, the favorite PCOS, or certain medications that you are taking maybe for your depression, anxiety, or certain other meds, contraceptive medicines that you're taking, they can cause you irregular cycles. Certain gynecological problems, you have endometriosis, adenomyosis, fibroid, polyp, and the list goes on, which can give you an irregular cycles. When you've just entered your puberty, जब आपने देखा होगा, you're worried क्योंकि क्लास में आपको पीरियड स्टार्ट हुए हैं, the girl is young, just 13 years old, and you are struggling with your irregular cycles. You say the cycles are pretty erratic. They do not come for 2 months, they come for 3 months. So at the onset of puberty, it is very normal to have irregular cycles for a year or two. Or when you are in the perimenopausal period, that is where it becomes irregular. So, what are the causes? The causes are different for every individual. So, before you jump to any conclusions of self treatment, you need to get yourself evaluated with your gynecologist so as to determine what is wrong in our particular case. The age per se has an important impact. Now, with age, what happens is your incidence of irregular cycle, chances of you having an irregular cycle keeps on increases. So now when we talk about premature ovarian insufficiency, we need to talk about menopause as well. Many people would be knowing it. I would still briefly touch it. So we know that what is menopause. हमने मम्मियों को सुना है क्योंकि my mom is entering menopause. Or maybe we at some point of age, like around 40s we are like हाँ menopausal symptoms लग रहे हैं, periods irregular हो गए हैं, I might be hitting my menopause. So your ovaries, your reproductive, the entire system per se, that started working once you hit your puberty at the age of 13 when you had your first periods. Now the ovaries and the uterus, they've been working diligently for all these years. At the age of around 45 to 50, that is when they shut down their entire factory. They say, okay, now we are done, we've worked enough. So that is known as menopause. That is cessation of the working of the ovary, the hormone production and everything that comes to a halt, that comes to an end. So now what is the average age of menopause that you would say? So in India, the age is somewhere around 46, 47 years, whereas worldwide, people would be having their menopause at around 51 years of age. So when do we get worried? When is it too early? So if you attain that menopause before the age of 40, that is where we need to be worried. That is when it is known as premature. So having like I've completed my family, and if I get a menopause at around 38, should I be bothered about it? I don't want any future pregnancies per se, or I never intend to get a baby. So that does it going to impact me? So yes, it is going to impact you. So before we get into the implications of premature ovarian insufficiency, let me tell you the incidence. The premature ovarian insufficiency. Now, the incidence of a young girl between the age of 18 to 25 would be 1 in 10,000. So if we go by percentage, see less than 20, it will be around 0.01% that a girl would have the chances of POI. At around younger than 30, it would be around 0.1%. And for women between 30 to 40 years, the incidence would be around 1%. So, what are the symptoms? How do I get to know that I might be facing this problem of POI? The first and foremost, which tells us everything, is the menstrual irregularity. You can have early cycles, you can have delayed cycles. Most likely, you would be having a delayed cycle, missing your periods, amenorrhea. You might be facing difficulty in conception, subfertility or infertility, or there may be menopausal symptoms. Menopausal symptoms like irritability. You might have depression. You might have noticed hot flushes, dryness in your vagina. So these can give you an indication that you might be facing POI. You might have changes in skin pigmentation, hair loss, anxiety, and fatigue. So, what are the causes that lead to primary ovarian insufficiency? So, most commonly that we know is a spontaneous POI, where we cannot pinpoint a particular cause which led to it. Apart from that, one of the major causes is the genetic causes. So, there are certain genetic mutations like the Turner syndrome, Fragile X mutation, or galactosemia. Any microdeletions in the X chromosomes or translocations, which can actually lead to premature ovarian insufficiency. Apart from that, if you had chemotherapy or radiotherapy due to certain pelvic malignancies, that can also lead to ovarian insufficiency. If there has been a surgery on your ovaries, that can lead to reduced reserves and POI. If there have been infections, viral infections like mumps or euphoritis, or site CMV infections, or you have HIV, or you've had tuberculosis, they can also accelerate your ovarian degeneration. Or it can be due to certain environmental exposures. Tobacco per se will lead to tobacco has had a proven role. Now we do say that the environmental pollutions, the toxins that we are exposed to, the stress that we are exposed to, that does accelerate your ovarian aging. But in different scientific papers, it is tobacco that has been significantly proven to affect your ovarian functions. So how do we diagnose it? Now see, if you've had amenorrhea for at least 4 months, did you go ahead to a doctor, you get yourself evaluated. There's a serum FSH hormone levels that need to be measured. If your FSH levels are more than 25, which are accompanied with your estradiol levels which are low, and the FSH is repeated again after 4 weeks, it still persists to be high. That is when you are diagnosed as a case of premature ovarian insufficiency. Now, apart from these, we then carry out further blood tests, lab tests, so radiological investigations to evaluate the cause and the effects. So, obviously, if there is amenorrhea, we would like to rule out pregnancy first. The other genetic mutation test, associated autoimmune conditions like the adrenal conditions or thyroid conditions, they would need to be further evaluated. And the findings are corroborated further by a transvaginal ultrasound, which would show us reduced reserves in the ovaries. They help us clinch the diagnosis. So, when we are talking about premature ovarian insufficiency, what are the symptoms that we're dealing with, or its implication that I said? So, if our body was supposed to undergo all these changes at the age of 50, but due to certain reasons or spontaneously, we have that ovarian insufficiency, say for instance, at an age of 35, so we are around 15 years early. So, there are menopausal symptoms which are going to affect us, and there would be a long term sequelae of the entire hormonal changes. So the menopausal symptoms, as we mentioned earlier, they would be affecting your mood, your temperament, causing irritability, emotional disturbances, along with hot flushes, night sweats. You might have urinary complaints, vaginal dryness, pain during your sexual relationship, amenorrhea, decreased libido. Apart from these, the hormones in the ovaries, contrary to the popular myth that they are needed only for pregnancy and reproduction, they also help your body stay healthy. So when we say staying healthy, they actually affect your cognition and your heart and bone health. So if in case we are in dealing with premature ovarian insufficiency, reduced hormone levels, they can severely impact your cognitive impairment. They can actually affect your cardiovascular health, putting us at a higher risk of heart failure, heart diseases. The autoimmune diseases that come along with it, they can cause a significant morbidity. The bone strength is reduced, leading to osteoporosis and predisposing you to a higher risk of fractures. It also affects your fertility significantly. So when we talk about fertility and all the hormones, now all these symptoms per se can be managed by hormone replacement therapy. Now those hormones which were ovaries were supposed to make, if it is not able to make it any further, we need to replenish those hormones in your body, at least till the age of 45 or the natural menopause. So when we're talking about hormone replacement therapy, we're talking about estrogen and in women with intact uterus progesterone. Now this estrogen can be in the form of an oral medication, gels, or transdermal patch. And the progesterone can be in the form of injections, vaginal gels, oral tablets. Whatever is comfortable to you, you need to get in consultation with your gynecologist and find out which hormone therapy works out best for you after excluding all the risk factors and contraindications to particular hormones. Now, the most important topic, thing that we have to deal with is fertility in POI. Now, we're talking about young women who are less than 40, and we know that in today's era, it is only until 35 that we even think of settling down. Women are, we are already struggling in our careers. We have to manage, and suddenly, if at the age of 35, we are diagnosed with ovarian insufficiency, how do we deal with it? When do I suspect I might be needing any further help or other assistance for my fertility, or I might be a candidate for POI, or if in case of being diagnosed, how do I proceed with it? So when we're talking about premature ovarian insufficiency, we need to remember that up to 25% of women may have a spontaneous ovulation, and out of all the women, 5 to 10% may conceive and deliver a healthy baby. Now, where are we concerned? Now, if in case for premature ovarian insufficiency, we attributed a genetic cause, a premutation or a deletion or translocation in the X chromosome, fragile X premutation. Now, there would be a chance that it might transfer to the progeny. So, hence, once you've been diagnosed with POI, you've been able to pinpoint a cause, say for instance, a genetic cause to the condition. Before you go ahead with your fertility planning, you need to have a preconceptional genetic counseling so that we can reduce the chances of transmission to the progeny. Now, how do things work out? How do we help out? So now, if in case you have a family history of early menopause, now you go back home, ask your moms, when did you have your menopause? They usually take it too lightly. It would be a little difficult for them to remember. They usually have a vague idea. You can correlate it with your age. What standard class was I studying in? When did you have stop having your periods? When did they start becoming irregular? Now, if in case your mom had a menopause before the age of 40, that is where, if whatever your age is, you need to be concerned about it, because that puts you at a risk of having a premature ovarian failure or premature menopause. So get yourself evaluated. If your elder sibling is facing fertility issues at a young age, say for instance 33, 34, she's facing decreased ovarian reserve, or there is history of mental retardation in the male members of your family, that is where you need to be concerned for the fertility. Get yourself evaluated. If in case our fertility is good, AMH is borderline or towards the lower side, and we've not yet settled down, we can always have a fertility preservation. We can cryopreserve our oocytes, and even if we have ovarian insufficiency or premature menopause, later at the age of 30 or 35, we can still use our cryopreserved oocytes to have a baby of our own. If we've already been through it, we've had irregular cycles, and now we discover ki, okay, now my ovaries are not working, my FSH is high, my ovarian reserve has significantly diminished. How do I proceed with my fertility? How do I get my pregnancy? So when we are dealing with that, now the first thing is that we have to remember is, now the ovarian reserves are significantly reduced. On further evaluation, you may or may not have a genetic etiology to the pathology. So, in order to achieve fertility, there is always an option of oocyte donation program. This along with HRT. Now, we in India per se, we would say that we have a habit कि we think as IVF the last resort. But if we think okay, we might wait and take it for a later stage, so the hormone deprivation might affect your uterus and your body adversely. So we suggest that it is better we start with the HRT, think about the fertility, plan your oocyte donation program or getting gametes, and planning your pregnancy through IVF. If in case we have it is towards the lower side where we can still retrieve our eggs, the IVF stimulation with embryo banking and a pre-genetic testing for a mutation which has already been detected in the patient, that might ensure a genetically healthy offspring or progeny in the patient. So what are the newer advances that we have? Is there any new advances to deal with it? So of late, there's a lot being talk about the intra-ovarian stem cell installation and intra-ovarian PRP installation. There have been multitude studies internationally as well, where stem cells or PRP, they are instilled through the vagina into the ovaries. Now, what does it do if you are into the lower ovarian reserve or in total insufficiency or menopause? The lower ovarian reserve have had a better quality of mature oocytes on further IVF stimulation and embryo banking, and the chances of having a pregnancy through IVF has been increased in at least 70% of the patients. Those who've already been in premature ovarian failure established, where we are not looking for pregnancy through the self gametes, the intra-ovarian stem cells or PRP installation, it has also helped in resuming the menstrual cycle. Now, when the cycles resume, that means the hormones have started working in the body. So it may delay, may give you another ledger of 1 to 2 years where you can continue without the HRT, where your ovaries start working. Though they are still in the research studies, but they are being done regularly now for low ovarian reserves and for ovarian insufficiency, and has been showing good results for with the same. So I just want to tell you, all those there who are having, first is every time you have an irregular cycle, it is not a PCOS. Every individual is different. You need to get yourself evaluated further. Go back home if you're not going to plan your pregnancy. We are planning to delay our pregnancy and not sure about oocyte cryopreservation or fertility preservation. Go ask your mom, when did you have your menopause? Did you have any trouble conceiving? So, if in case your mom had early menopause before the age of 40, that is where you need to be alarmed. Get your fertility checked. If your elder sibling has been through difficult times, conceiving, faced low ovarian reserve, that is when you need to get your fertility checked. If you have irregular cycles with any of the menopausal symptoms like hot flushes, menstrual disturbances, irregularity, that is when you go to a gynae, get your fertility evaluation done as well. And depending on that, you can opt for fertility preservation, planning your pregnancy, or just monitor with the treatment prescribed to you for your particular condition. Premature ovarian insufficiency is not the end. Your health matters the most. So, in order to ensure a healthy lifestyle, you need to follow HRT. You need to have your HRT in place. You cannot discontinue it. It is advisable to continue it till the age of 45 so that you can have a healthy lifestyle. You can have a healthy body, your heart, your bones, everything. You can go on that trek when you are 50 plus without the risk of having a fracture or a heart failure. So we need to have your HRT on time. oocyte donation has significantly improved the chances of fertility. So oocyte donation is one thing that can actually increase the chances significantly of you having your pregnancy, achieving the dream of motherhood. If in case you want intravariant PRP and stem cells that are being routinely done at Oasis Fertility to help people with low ovarian reserves and even with premature ovarian insufficiency, where established menopause is there to help you with resumption of normal cycles. So whatever, if you have any query, feel free to connect with us. We would be available constantly on all the social medias and the helpline number. Thank you. Any queries? How serious is premature ovarian failure? Premature ovarian failure, as we've talked throughout the PPT about it, it is not something to be taken very lightly. Apart from the fertility aspect, we're also talking about your health, where premature ovarian failure can significantly affect your heart and bone health. So it is something that needs to be seriously evaluated and treated. See, the most common treatment for premature ovarian failure, if you want to, depends upon what are you looking forward to. So one thing, the most common one is the HRT. After evaluation, so that we can rule out any other autoimmune conditions which are being exacerbated along with it. It is the hormone replacement therapy which is going to give you relief. So premature ovarian insufficiency, the basic diagnosis is you've had an if you've not had periods for 4 months, amenorrhea of 4 months, along with an FSH more than 25, accompanied with low E2 levels and low AMH levels. The FSH being repeated again after a month. Can stress? Yes, there are no studies per se, but it is do indicated the stress, environmental toxins, tobacco, all these do accelerate the ovarian aging. So, if in case you have any queries regarding it, you're confused regarding a diagnosis, or you want to know about the recent advances that are being offered, feel free to call us at the fertility helpline. And we at Oasis Fertility would have all the recent facilities and the advanced techniques to help patients of all different areas to achieve your dream of motherhood or parenthood. Thank you so much.